The suboccipital triangle, also known as the suboccipital region or the suboccipital space, is a triangular area located at the back of the head, just above the neck. It is formed by the convergence of several structures in the region. The boundaries of the suboccipital triangle are defined by four muscles. Rectus capitis posterior major. This muscle runs from the spinous process of the axis, C2 vertebra, to the occipital bone at the base of the skull. Rectus capitis posterior minor. This muscle originates from the posterior tubercle of C1 vertebrae and inserted into the inferior nuchal line of the occipital bone. Obliquus capitis superior. This muscle originates from the transverse process of the atlas, C1 vertebra, and inserts into the occipital bone. Obliquus capitis inferior. This muscle arises from the spinous process of the axis, C2 vertebra, and inserts into the transverse process of the atlas, C1 vertebra. The muscles serve as postural support of the head and neck and allow extension and rotation movements of the neck. The innervation of all the suboccipital muscles is the suboccipital nerve, which is the dorsal ramus of the C1 spinal nerve. Contents of the suboccipital triangle. Within the suboccipital triangle, several important structures pass through or are located in this region. Suboccipital nerve. The suboccipital nerve is a branch of the dorsal ramus of the first cervical nerve, C1. It innervates the suboccipital muscles and provides sensory information to the skin of the posterior scalp. Third part of the vertebral artery. The vertebral arteries are the main blood vessels that supply the posterior part of the brain. They enter the skull through the foramen magnum and pass through the suboccipital triangle before joining to form the basilar artery. Suboccipital venous plexus. This is a network of veins located in the suboccipital region. It drains blood from the scalp and other structures in the region. The suboccipital triangle is an important anatomical region due to the presence of these vital structures. It serves as a gateway for neurovascular structures entering or leaving the skull and plays a significant role in the movement and stability of the head and neck.